to order. The chair notes that there will be a Reflect and Remember community vigil this evening from 5 to 6 at the Ali Center or on the Ali Center Plaza, as well as local religious services at a variety of locations around the city. And you can go to Louisville Metro, I call it OSHA. Somebody's going to have to help me with it, but the Office of Safe and Healthy something. We thank the Metro government for all they have done, and especially to our mayor, who has, in essence, captured the compassion and emitted it to the entire country. While national news commentators noted that Louisville is a, quote, small town where everyone knows someone who was impacted, they were quick to highlight that the alacrity and precision of our heroes saved many lives. Truly best practice for the nation to witness. This unconscionable event has left us with a clarion call to action, not words, for our community. Our mayor, also a board member, was both personal and forceful in his interviews with national reporters, stressing his own experience as a target of gun violence and supporting a state legislative effort to give Louisville the power to enact sensible gun reforms, given that most of the state stands in opposition. As you are probably aware, immediately following the shooting, another occurred nearby. The numbers are increasing, not decreasing. While words and prayers are definitely in order, we need action that changes this trajectory. I will be talking with the mayor as to what this board can actionably do to assist in his efforts. At the very least, I ask, can everyone mute their phones, please? There's a little feedback. At the very least, I ask each of you to reach out to your connections and networks seeking actionable input. Also, as requested by the mayor and the on-site physicians, please donate blood and send that message to your networks. Please join me now in a moment of silence to remember the victims and their families and to contemplate what each of us can do to help change the course of gun violence. Thank you. The chair also is asking Dr. Louis Hargett, as Greater Louisville Medical Society's representative to our board, to encourage his organization to back the mayor's efforts to make sensible changes in the laws governing guns. Physicians are deeply respected by their patients and by the public and could make a difference, as Dr. Jason Smith proved in public support and opinion. Before we move to the perspective section, one piece of business. The minutes of the March meeting were circulated to you in advance. Are there any additions or corrections to those meeting minutes? Hearing none, the chair will entertain a motion to approve the minutes as distributed.
Move to approve.
Is there a second?
Second.
Any opposition? The meeting minutes stand approved. As always, are you all getting feedback? Okay. As always, this meeting begins with the end in mind. Optimal health is significantly driven by environmental health, including the quality of air we breathe and the water we drink and shower with. Here in Louisville, the Ohio River provides major economic incentives to companies to locate and expand here as we serve as a distribution channel to move products across the country. As such, the river has its downside as it is susceptible to accidental spills and odors, some of which could be toxic and could lead to long-term deleterious impact on people's health, from heart and circulatory issues to brain development issues. Many of these type plants are located in the south and west ends along the river's edge. These plants and manufacturers do attest to their diligent efforts to maintain statutory, regulatory, and contractual compliance. The question remains, is that enough to ensure equitable, optimal health for those who live near those facilities' catchment areas? For example, Rubbertown, the South End, West Louisville. In her update, I believe, Mayor George, and I don't want to put words in your mouth, but I believe you shared with me a current example related to odors that you have been dealing with. Recall that during last month's meeting, we highlighted a similar issue in East Palestine, Ohio, caused by the toxic train derailment and the preparedness of that community as it relates to the potential lifetime public and environmental health, as well as human and community impact. We talked about the fact that as public health leaders, we should deep dive into our own community's preparedness for a similar occurrence. And this month, thanks to the preparedness efforts of the city's emergency management services efforts, the agency successfully removed an ethanol-laden barge that was lodged at the Louisville Dam, a best practice example. That said, we also know the impact of emissions and releases from factories, manufacturers, and plants in these areas. What are public, private, community entities doing to ensure best practice preventive, surveilling, and redundant compliance measures are in place? Are there specific takeaways from recent episodes that would spur new public health policy? What are we as public, private, community, academic, and public health leaders doing to help ensure that all state, federal, and local laws and regulations are in full compliance, being enforced, and that companies and government agencies are being held to the highest standards? Enforcement and monitoring by government agencies and related parties are critical. What are the collective we effectively doing for the communities that could be impacted by the air, water, and soil in these areas? And are there newer helpful public health policies the board should adopt, advocate for, that would move us forward as leaders in this space? To act on this issue, we begin today with an educational session, Ensuring Safe and Clean Water. A special shout out to Dr. Ted Smith and Taylor Ingram for their assistance in securing our speakers. Joining our panel are Dr. Sanjay Srivastava, or better known as Dr. Sanjay to me because I've just horribly messed up his last name, Director of the University of Louisville Superfund Research Center. Dr. Sanjay is a distinguished university scholar and professor of medicine at UofL. He is also the director of the University of Louisville Superfund Research Center, funded by the National Institutes of Health. Since 2002, Dr. Sanjay's research program has been continuously funded by multiple NIH grants. He has also served as chair or a member on more than 50 NIH grant review committees and published over 140 research articles. Focus of his research is to examine the effect of environmental chemicals on heart disease and diabetes. Next, we have Chris Bobay and Brad Hart from the Louisville Water Company. Chris Bobay is the manager of water quality and compliance for Louisville Water. He earned his MS and MPA degrees from the Indiana School of Public and Environmental Affairs. He's a licensed water treatment plant operator with nearly 20 years of experience in water quality, including 15 of those years at Louisville Water. Brad Hart is a safety, security, and emergency preparedness leader with over 18 years experience in safety and loss control programs. He is currently the manager of security and emergency preparedness for Louisville Water, who's responsible for the development, implementation, administration, and continual refinement of physical security and emergency preparedness programs, where he leads initiatives to identify, assess, and mitigate the risks, threats, and vulnerabilities faced by Louisville Water. Meghan Brown is from MSD, and she is MSD's Emergency Preparedness and Operational Resiliency Administrator with 15 years experience in the wastewater sector. She is responsible for business continuity, emergency response planning, and education solution planning through grants application development. And finally, Jim Bonham from Louisville Metro Emergency Management Agency has 14 years of power plant construction and maintenance experience, 9-year safety director for an industrial environmental contractor, including hazardous chemical spill response and mitigation. And for 20 years, contracted to the Air Pollution Control Board to perform audits that address the Clean Air Act Risk Management Program. So with all of that introduction, the chair yields to, and I haven't watched my screen, so I apologize, Chris Bobay and Brad Hart, Louisville Water Company. Are you on?
Yeah, we're here. Can you hear us?
Yes, thank you so much. A warm welcome.
Okay. Well, thanks, Madam Chair. Appreciate the opportunity to speak with all of you today on this panel. For those that don't know, I was asked to come and share a brief overview of our spill response, in particular to the, related to the incident in East Palestine, Ohio. I'll try to keep my comments brief. I know we're on a pretty strict agenda today. I'm happy to stick around, by the way, afterwards and answer any questions you might have. I don't expect this will be the last or final meeting on this topic, so looking forward to working with all of you. So I served as the technical lead for Louisville Waters' response to the Ohio River threats associated with the train derailment in East Palestine, Ohio. My team, just for clarification, my team was not directly involved in the environmental response to the train derailment or the subsequent cleanup efforts near the derailment site. Our mission is to protect drinking water quality in Louisville. So that's from the source to the tap, we say. So source water quality means everything to us. And if those don't know on the call, our source for the city of Louisville is the Ohio River. So our focus is leading the investigation on threats for the Ohio River. The Ohio River, it's a great natural resource. We're very fortunate to have such an abundant source of water here, but it's a very dynamic and challenging source. It changes every day. It's also a major transportation corridor, as many of you know, for the industrial Northeast. I guess with the recent barge incident with methanol, I guess that underscores the importance of monitoring for those types of threats. So we have to be prepared for whatever comes our way. We typically see hundreds of spills every year that get reported to us through state agencies, through federal agencies. Chemical spills, sinking barges, boat fires, illegal discharges, that kind of thing. So we're not just there to investigate spills. We also do a lot of proactive monitoring and surveillance. I oversee our laboratory operations. We're very much involved in surveillance of the river for not just chemical threats, but seasonal issues, harmful algal blooms, nutrient herbicide runoff issues, and aesthetic issues that might cause taste and odor issues for our water. So let's get into the train derailment. So I'm sure most of you saw the news about the train derailment. This was, national and international news. Most of us saw the videos of the burning rail cars, the big plumes of black smoke. All that occurred on February 3rd. That's when the train derailed. There were a total of 50 rail cars associated with this derailment, several of those containing hazardous chemicals, vinyl chloride, several other liquid chemical rail cars, as well as dry materials. But you probably heard the reports of the hazardous chemicals that were released to the air and the water, of course, in the local area. So it's certainly true that some of the rail cars did spill their contents immediately after derailment. As the reports indicated, some were quote pierced and flared, which is just an interesting way of saying they drained the chemical out and they burned it. So it's true that some of those chemicals got into local waterways, and there were associated fish kills near the incident site. It's also true that some of those chemicals eventually made their way through local waterways further downstream and even into the Ohio River. It's also true that the levels that were detected in the Ohio River were never a threat to public health. But still, I say that, but still there was a lot of public concern that the Ohio River was contaminated. And social media went viral, lots of misinformation, scared a lot of people. There was even a rush on bottled water here in the city of Louisville, as I'm sure it was for other river cities. So people were getting mixed messages and they didn't know what to believe. So just for some context, the Ohio River is 981 miles long, starts in Pittsburgh, all the way down to Paducah or Cairo, Illinois. If the river starts in Pittsburgh, we'll call that mile 0, okay? And Louisville is situated at mile 600, okay? So where this spill, where we detected the first chemicals associated with the spill, was at mile 40. So the entry from the creeks and the small tributaries that enter into the Ohio was at mile 40. So right at the start of this incident, Louisville was, more than 560 miles downstream of this incident. On February 6th, 3 days later, we had the first detections in the Ohio River immediately downstream of the site. That detection triggered an interstate spill response effort led by an organization called ORSANCO. That's the Ohio River Valley Water Sanitation Commission. This is an interstate commission that it's formed over 75 years ago by all the basin states, and their mission is to protect the Ohio River and its uses, including drinking water supply. So it's important to think of ORSANCO as like the Ohio River watchdog. They were part of the unified command structure that was principally responsible for responding to this environmental incident, and they were our liaison with federal EPA as well as Ohio EPA on that larger environmental response. So we've Louisville Waters been heavily involved participating with ORSANCO for decades. We helped work with them to build the monitoring infrastructure that allows us to continuously monitor the water quality of the river. And so today we're part of that network still. It's a network of 17 water systems along the Ohio River that operate lab instrumentation. Some of that instrumentation is owned by ORSANCO, operated by the water utilities, and we monitor the river continuously for types of chemicals that were spilled in this incident, volatile organics. So this network collaborated during that incident to track those chemicals in the days following the spill. We tracked chemicals at low-level detections as far as Huntington, West Virginia, which is mile marker 300 on the river. So after Huntington, West Virginia, though, we never got a detection of any of the chemicals. And there were only 2 chemicals primarily that we detected in the river associated with any of the contents that were associated with the derailment, and 1 chemical that was a derivative of one of those chemicals. And these levels were hundreds of times lower than any health risk screening level. So what's interesting, and I just want to end with this, there's 2 things I think that were very significant factors in the water quality of the Ohio River relative to this spill or related to this spill. Number 1, in the first week of this incident, we had uncharacteristically warm water, warm air temperatures, warm weather that when you have a chemical spill of an insoluble chemical like we had with these that were on some of these rail cars, we had optimal conditions for natural degradation, natural dissipation of volatile chemicals. So that first week with a slow moving river, dry conditions, warm conditions, that was really good for this spill. We saw a lot of degradation in the first few days. And then what happened is we had late that first week, we had heavy rains and it washed the entire basin out. So we followed that dry season or that dry spell with just full on dilution and flushing out of everything that's in the river. So that was a 1-2 combo, I think, that really served the city of Louisville very well. Throughout this response, we worked with Orsenco to coordinate field operations and collaborate, especially with upstream water utilities. We have a very close relationship with Greater Cincinnati Water Works. We collaborated on everything from expanded our monitoring capacities, as well as some of our testing for treatment technologies and treatment approaches if we were to treat something. We had close communications with DEP. I know Buck McCloud's on this call today. His ERT team, as well as Division of Water, that's our regulating body, regulating agency. Multiple press conferences. We published health information and data on our website daily for customers, for stakeholders. We continued enhanced monitoring during and throughout the event, even after the event. Never a single detection of any of these chemicals in the water at our Louisville intake. So since the incident, my team's been busy with after action review process, which we always do for incidents like this. We've completed our internal review. We've met with Metro Council. We've met with many of our critical customers, and we have planned meetings with Orsenco to debrief from their perspective and talk about, you know, what went well, what didn't go so well, and what we can learn from. And we'll continue to meet with external stakeholders to do the lessons learned after action review. So with that, I think I'll stop. I'm probably over my time anyway. And I just wanted to allow my colleague here, Brad Hart, to introduce himself real quick.
My name is Brad Hart. I'm the head of security and emergency preparedness for Louisville Water. And in the interest of time and my emergency preparedness colleagues that are about to go after me, I will cede that. I know that what Chris had to say was very important. I think everybody needed to hear it. I will be available from a general emergency preparedness point of view in the Q&A from a Louisville Water perspective. But a lot of the things that my colleagues from EMA and MSD and KDEP are going to talk about are things that we're intimately involved with as well. And we partner and collaborate with on a daily or weekly basis. So I will cede my time to the next.
Okay.
Thank you.
Thank you. And just in that follow-up, we've all read about the barges being safely removed from being lodged at the dam. So, and those carrying methanol. So clearly, any comment on that, but we'll wait on that. And we'll move to Meghan Brown from MSD, Jim Bonham, Louisville Metro Emergency Management Agency. So Meghan Brown, I yield the floor to you from MSD.
Good morning, and thank you for including MSD in this conversation. We have close relationships with our One Water partnership through Louisville Water Company. And so emergency collaboration is not new to MSD. I'd like to first speak on why Louisville MSD's program is different and how we have shaped some of our internal trainings to address potentially catastrophic emergencies in the community. So Louisville MSD is an organization immersed in emergency management and preparedness. Inherently, we provide 3 utilities in one. We monitor river gauge levels, weather conditions year-round for levee safety, flood response, wastewater treatment, and drainage. And that is no easy feat. We have close relationships with many of the emergency response communities in Louisville. As well, I would want to spend some time this morning discussing how we have shifted our understanding of MSD's everyday emergencies. Those are things like sewer backups, collapsed pipes, collapsed roadways due to our aging infrastructure, and talk about how we have been shifting our educational base over the last 6 years to also incorporate disaster preparedness on a much larger level. Specifically this year, I'm leading 33 of MSD's senior leadership through additional incident management team training that is provided at no cost through FEMA digitally. And then we are having some internal trainers trained up so that they can best offer trainings to our staff throughout the year. They're going through incident command system courses 100, 200, 300, 400, 700, and 800. And then May 18th of this year, that will culminate with an internal training based on a derailment scenario, contamination, and our staff's response. We are going to facilitate that through FEMA's HSEEP program. That is the Homeland Security Emergency Exercise and Emergency Program. That program will allow us to create an after action report so that we can best capture our staff's response and then tailor trainings based on that response and continue offering trainings throughout the year. And we typically offer 4 of those types of trainings internally to our staff. Additionally, we look at best practices across the nation. We engage with our 5 Cities Plus partners. It is not common for wastewater utilities to offer flood protection for levee systems. And so that is a challenge. That's a financial challenge. That is a staff challenge for us. And we have excellent staff that do monitor that situation year round. But we also have emergency response plans that are extremely detailed and business continuity plans that we update biannually. Those detail how to recover to mission essential functions post-emergency. And sometimes that's a very valuable document because people don't always understand when the emergency is over and what needs to be reported and how to continue back to daily response. In January, Louisville MSD was able to request that Texas A&M University bring a disaster management course specifically for water and wastewater infrastructure to Louisville, Kentucky. And my goal is to repeat that course this year in Q3 or Q4. And I will offer to share the pre-registration links and that information with this group as well.
Perfect.
That course is part of a 4-part disaster certification for infrastructure catastrophes. And so the more people we can have trained in the Louisville area, in the region, the better. And I would be remiss if I didn't speak on this one facet of MSD's community-based response in light of Monday's horrific incident, that we have also had an exercise, a multi-agency exercise in 2019 with Louisville SWAT, MSD, Emergency Management, and that was an active shooter training at our main office. From that, we captured lessons learned, and we were able to continue Stop the Bleed courses provided by UofL Health at no cost, and we offer our staff free digital Stop the Bleed training online as well. We took that a step further. I was given a budget to purchase Stop the Bleed kits, and with the guidelines of University of Louisville's Trauma Center, we were able to instead purchase the materials, produce those kits, and we were able to produce 3 times as many for the same cost. And we have been distributing those to our staff who have taken Stop the Bleed training. Those are safety kits in addition to our standard safety materials at every office in our fleet vehicles. But that's another way that we can help our staff be the help until help arrives. I don't know a lot of the agencies that are doing that, and I'm incredibly proud that MSD considers the safety of our staff at home and at the office. So additionally, what I feel is not being done is better communication when we have water and wastewater based emergencies. During the East Palestine incident, myself and Louisville Water, we did speak. MSD did not have a direct response action from the community perception, but we did stay on top of that information and stay ready in case we needed to bypass any water from Louisville Water Company to our treatment centers. But it is important to note that we do not do chemical treatment, we do biological treatment at MSD. So there is only so much we are able to do in those types of events, but we are there to help. And I want to say that a best practice we haven't adopted yet is more community-based exercises, perhaps through the LEPC or the Rubbertown Mutual Aid Group. That specifically is an area that is high with risk due to the amount of chemicals and its location. And I would like to see much more training provided through that group.
Let's wrap up a little
Yes.
because of time, and take your insights during the discussion session, if that's okay with you.
It is. Thank you.
Dr. Sanjay? Oh, I believe you're on mute.
Good morning, everyone.
Thank you.
So my group focuses to study the health effects of these environmental chemicals, similar to what you heard about East Palestine vinyl chloride and structurally related airborne toxicants. So with the help of the Superfund Research Center, we look at the levels of exposures in the air, water, and soil of these chemicals, and look at their potential health effects. So when we started off in 2017 with this program, since then we have built a cohort, which is a prospective study, longitudinal long-term study, where we are looking at the effects of these airborne toxicants, primarily on heart disease, liver disease, and diabetes. And the program is structured in such a way that we have two different arms of this program. One is related with the environmental exposure assessment, and the other part is the health outcome. So for the environmental health assessment, we strive to develop new technologies for better detection and remediation of these kind of chemicals which have adverse health effects. For that, we partner with Washington University in St. Louis and Yale University. And with the help of that program, we have developed some very sophisticated devices which can do the real-time monitoring of these chemicals. On the health side, we have developed a cohort which has now more than 900 participants in the study. We started looking in the South and West Louisville, but now this is extended throughout the Jefferson County. And our goal is to enroll about 1,200 people in the study, so we have enough power to understand the health effects, both short-term and long-term, of various environmental chemicals. What we know right now for these chemicals is very limited, essentially limited to short-term toxicity or exposures and acute toxicity. We don't know what are the long-term health effects, and pertinent to what happened with the spillage in East Palestine, and something similar happened about 10 years ago here in Louisville in Bullitt County when there was a derailment and butadiene was spilled. So we don't know what happens when we are exposed to very high level of these chemicals for a short period of time, and what are the long-term consequences of those kind of exposures. If people may recall that similar things has happened in the past in the Camp Lejeune area, where people were exposed to TCE and benzene, and we came to know about their toxicity several decades after that. So we really have to be proactive and study them in greater detail, so we are better prepared to combat any potential challenges that we face. So keeping that in mind, the University of Louisville Superfund Research Center has deeply invested in this program, and we are trying our level best to look at the potential health effect of these chemicals, and also come up with plans which could be useful in remediating these chemicals. There are two different approaches. One is we are trying with Yale University, as I said, where we try to do the thermal degradation of these chemicals to the smaller molecules, which are relatively less toxic or non-toxic. The other part is adapting a natural process which could facilitate the remediation process. What we call here is a Green Heart project, where we are studying whether increasing the vegetation can absorb some of these airborne toxicants, whether they are actually in the air or they are in the water or they're in the soil. All that can be absorbed by the trees. And then trees have the similar mechanisms as the human body has to detoxify them in the relatively inert molecules. So we are doing this experiment in the west south Louisville area, where in certain neighborhoods we have planted large mature trees, and comparing the airborne toxicant levels and the health effects with the areas which are relatively lower in tree canopy. So I think this is one of the ways we not only understand the toxicity of these chemicals, but we can also come up with practical ways which can be beneficial for the health outcomes.
Thank you. Enlightening, and we'll get to insights and policy changes or additions that need to be instituted to help accelerate this program. Let's see, where are we here? Jim Bottom, Louisville Metro Emergency Management Agency.
Good morning, everybody.
Hello.
I will, I think I want to go over, some of our capabilities for response here, but I just want to highlight that the point that I come from is, I started in industry. I've been a hazmat technician since 1986, 85, something like that. And so I've seen response from the community when I worked in the plants locally. And after that, we did environmental cleanup at the company I worked for. So I've worked with city agencies in that regard, where we're called to a scene and then the scene's handed over to us to do cleanup from the agency. So I've met a lot of the local responders long before I came to work for the city and understand that relationship between contractors. And that's the viewpoint I come from. I want to mention the Palestine briefly, and that, some of the difficulties our information we got about Palestine initially comes from the media, which is intended to excite people, because it sells their product, and some of the data about Palestine that's different than it would be here. When we look at this problem, we can look at East Palestine. We need to put it in perspective to how significant the problem would be here. I opened up a hazmat program that I have when Palestine occurred and did some rudimentary looking around there. East Palestine, they talk about the river being contaminated. Well, East Palestine is 14 miles as a crow fly from the river. So a lot of their problem there is actually a significant amount of ground contamination, because it took a 14-mile trip to get to the Ohio River. We're not that fortunate here. We're a river city. If we have an incident here, the likelihood of getting to the river may be more significant than it was in East Palestine, just because we have so much drainage here. We're a major drainage basin, and it's a shorter trip in many places where the railroad track is to the river. And also our population density, the specific areas that we mentioned earlier, Rubbertown, West Louisville, South Louisville. East Palestine, from where that incident was, there's 147 residents from the point of that rail incident. We will not be that fortunate should something occur here. Our population density, very few places in our county, our city, that have a population density of only 147 people in a 2-mile radius. So just when we frame this, we want to make sure we think about how significant the problem would be. Now, to follow up on that, how are we prepared? What do we do to prepare? You know, we have a hazardous materials ordinance that MSD is the overseer of that, and they have hazardous material pretreatment inspectors that go to facilities that have unused chemicals in their processes. That came back, was started back in 85 or 86, a few years after our sewers blew up here because a industrial company pumped hexane into the sewers. You know, Louisville Fire has a hazardous material permit process that they use there. Fire safety inspectors go and visit the plants that have hazardous materials within the boundaries of the City of Louisville Fire Department. Air Pollution Control District is an implementing agency for the Environmental Protection Agency. So, which means they oversee the air regulations for Jefferson County. One of the programs that I'm an inspector for is the 112R. So the 20 facilities in town that have significant quantities of highly hazardous chemicals, air contaminants, they get an inspection. I hit about every plant gets inspected on a 3-year cycle, which if you look at the statistics for Region 4 EPA, our facilities here are on a higher level of inspection than probably anywhere else in that whole region, just because I'm local and I get out to them every year. The ones that the EPA does not get out as often for the programs where they're only overseen by the EPA. So we do have that advantage here, and I get a good feel for whether or not the chemical facilities are doing their due diligence and following the regulations. And if they don't, you know, then they get a influence to do that. I find that our chemical facilities here all are very diligent in their processes. Different than a lot of communities our size, there are a lot of hazardous materials teams, a lot of technicians, you know, in our community. And a lot of people don't know that, you know, the urban and suburban fire all train their firefighters to become hazardous materials technicians and train and practice the response techniques and purchase and use equipment necessary for that. You know, the health department has a hazardous materials team that also goes out, shows up on site, works in conjunction with the local responders. Many health departments don't have that, but as we're discussing right here, chemical release is a public health issue. So it's coming from Louisville. It's odd that more health departments don't have hazmat responders, since this is definitely a public health issue. So that's an awesome thing about our local health department. MSD, their hazardous materials pretreatment inspectors, emergency response and hazardous materials pretreatment inspectors are all hazardous material technicians. Louisville Police Department has the hazardous incident response team, also has hazmat technicians on the team. So for a community our size, we are well staffed to be able to respond, you know, to these types of incidents. And on top of that, the relationships with everybody I've mentioned is second to none. When I've had the opportunity to train with other people from other parts of the country, many people are amazed that our community, you know, the police and fire work together, and the health department shows up and they will come to hazmat scenes, and we're like, absolutely, that's where some of these orders come from for a cleanup, and then follow up to make sure things are cleaned up appropriately come through MSD and, you know, the health department. Some of the questions that I looked at, just ticklers for what we might discuss today. One of the questions was, what could we do better? And on the emergency management side of the house, in regards to hazardous materials releases, you know, one of our functions here is the emergency notification piece. And we've got a great, you know, Ray Mobile Safety powers our Louisville emergency notification system. We can use the Smart 911 app is the easiest way to use that. We need more people to sign up. We need more citizens in our community to sign up to receive notifications. So anybody that has any ideas or anybody that wants to include that on their web pages or want information about that, please reach out to Merchant Management. We'll provide you all the information you need. If you want to include that in mailers that you send out or anything like that, you know, we would really be excited to find ways.
Jim, I'm going to interrupt you to conclude, but before I do, would ask you to forward that information to the health department. And Arlena, would you send him your contact information so that we have it? And we can do that. Any final comment?
No, I appreciate that, and I will send that. I'll send it to Arlena, and any help anybody can give us, let me know. Thank you.
Okay. There's so many things on my screen here. Did I get everyone? I think before I open it up. And what I want to ask the people on the phone is, who has spoken to us is, are there public policies that need to be changed, or public policies that would help you, your agency, et cetera, do a better job and move quicker to even more best practice? Is there pending legislation currently, or pending rules, or? Anyone? MSD? Dr. Sanjay?
Not to the best of my knowledge that anything pending right now, but we work very closely with National Institute of Health and in some cases FDA also, and we share our research findings, which help them develop policies and from the regulatory perspective. But I'm not aware of anything which is pending or in the pipeline as of now.
Dr. Sanjay, one thing that might be very helpful, and Arlena can coordinate that as well, if you don't mind, Arlena. If you would send any recent or ongoing information that might be shared with the board so that they can disseminate it or use it accordingly in their own areas, that would be really helpful. Because what I've sensed in this process of both putting the panel together and listening to your comments is that what we need is stronger collaboration. Everyone, and I know there are efforts out there. I think maybe Megan or someone mentioned one, somebody did, or some bodies did. But that collaboration really needs to happen in order to be able to address the changes coming about as a result of environmental changes, if that makes sense to everyone.
Yeah, sure. So I will send some information your way.
You're wonderful. I appreciate it. And board, it will be disseminated to you, and feedback is asked for. And thank you, Arlena, in advance for serving as Master of Ceremony. And questions from the board? Comments from the board?
Heidi, I have a couple of comments.
Yes, ma'am, Madam
Really just more
Deputy
specific-
Mayor.
Thank you. Really just more specific to the communication piece. You know, I put a question in the chat really around, I agree with Jim that emergency notifications are tremendous. And, you know, obviously we need more people to sign up. But just to take that one step further, I think what often happens, or what I hear in the community, is that people get an initial notification of a spill, but they don't really know what the next steps are. So was that in the air? Was that in the waterway? Is it MSD that's the lead on that? Is it APCD? And so it's just really difficult to track. And so I didn't know if there was any sort of conversation at some point around not just that initial notification to the community, but then, you know, what the findings were, or who the lead agency is. The second piece, and I'm just going to say this, you know, my understanding is we do I say we, our city and our partners on this, in this meeting do a tremendous amount of work on our emergency hazard mitigation plan. It is a tremendous document. I know it took many years to prepare and was just approved, and Megan can speak to this as well as Jim. But the community largely doesn't know that it exists, and it's very difficult to dissect. Most of us have not read it in its entirety. And as I understand it, you know, each agency is kind of responsible for a little bit of the communication, but when it's everyone's responsibility, it's really no one's responsibility. And so, you know, at some point, I think it would be worth looking at how we, you know, do we create a one pager so that folks understand what, you know, the emergency hazard mitigation plan is, where to find it, what it covers, just really some 101 basics. And I've posed that to Director Myman, but again, I think probably need some deep thinking on who owns that and who's ultimately responsible for that communication. All that to say, it's tremendous work. Most people in the community don't know that it exists. That is all.
Is there
Thank
a
you.
way, folks on the speakers, is there a way to disseminate this information through, if they're helpful, through the Office of Safe and Healthy, whatever it's called, OSHA, through the neighborhood associations, et cetera, especially as, or other community groups? I'm just looking for proper distribution channels, because, and I would say this from a corporate standpoint, we get, there's an email, a text, and a voicemail that goes out in terms of any crisis situation or weather condition or whatever, that goes out to all workers in the affected areas. So what my biggest takeaway today was that nobody knows what anybody's doing together. And I think that is something that is important to public policy.
I mean, I don't know the answer to your question, Heidi, about whether or not Ocean keeps like a list of all. I mean, I would imagine they have something. I think it's really twofold. I think it's ensuring that for the lens alerts, you know, we are doing everything we can, not just with who's following their council page or who's getting a newsletter or but like, are we really, you know, focused and targeting certain populations that maybe would be less connected to get them signed up? And that often requires paid outreach, as we know. I think the second thing is on the hazard mitigation plan, it's promoting it generally, but then it's also how do you take all that information and digest it into something that is manageable for the public? Like, what are the need to know pieces of it? And until we do that section, I'm not sure what we would, I mean, you know, again, most of us know that this document exists. Now we've not read it maybe, or we've not read it in its entirety, but I think it's like, really, how do you take that and market it? I mean, quite frankly, it's a communication and marketing piece that's needed even before we get to how do you disseminate it.
Let me also share that, and the reason I'm sort of harping on this is that I think, as most people know, I'm in a small town on the west coast of Florida, affected by Ian, and this city, Naples, has a program called Code Red, and I get a text on everything from major accidents that cause issues to weather conditions to toxic water, since we also border on water, and any kind of alert that affects health and risk, etc. They use that, and so you know when you get a code red that it's an urgent issue that needs to be taken care of, and it's simple. It's very simple, and then it gives you a link to another site if there's more information. So you might Google Code Red Naples, Florida, and I think it explains it there.
You know, Heidi, our product here is the same thing. We are a former Code Red customer, And then we went with our current vendor because they were just a better vendor. And it has the same capabilities Code Red, if not probably more at this point. It
Can
continues
you
to
send a
grow.
link on that?
I sent it to Arlana.
Okay, good.
I've already done that.
Okay. I'll get you on my mobile.
All right.
Anything else, guys? Anything else, speakers, you wish to add?
This is Meghan Brown. I would just like to talk about the type of communication surrounding the recent barge disaster. And ultimately, a website rolled out to provide daily updates. And that was incredibly helpful and something that I'd frankly not seen in the Louisville emergency realm before. And I think that that could be a best practice moving forward, whether or not it is housed through the Metro government site or a Board of Health page. I don't know the answer to that, and that may depend on the incident's reach, command, and structure. However, to provide concise, clear messaging and one place for the public to go to find information, not turn to the news, not turn to social media, but to find one place that is informative would be incredibly helpful. And that's my opinion as a resident of the city as well.
Thank you.
And this is Brad Hart with Louisville Water. I 100% agree with Megan. We had an internal conversation about that website that EMA put up, and it was extremely beneficial for us. And I will speak back, Chair Margolis, to what you said about, I guess, not communicating enough. We in the emergency preparedness community here, especially critical infrastructure and the EMA, we work together weekly at least, communicate almost daily. We all have great relationships with each other. I do think that there is opportunity for larger tabletop exercises and stress testing of certain critical programs. But I do think we are a very tight-knit community from an emergency preparedness standpoint. And I do think that generally we know what each other is doing from that side. And going to other communities, we just went, Louisville Water was part of a team that went to Eastern Kentucky last August for the flooding and disaster management in a real-time scenario. There was a lot of lessons learned from that we brought back to the community here. And I do think that as far as Louisville in ranking with other communities, I think that we do a pretty decent job of communication from an emergency preparedness standpoint.
Let me thank you very, very much. Let me ask that an effort be made so that the deputy mayor who's in charge of health is also a part of that, so that because she and I both are concerned about the public becoming more educated. And I think that's an insight we take away from COVID in terms of never replicating the community response on that. And that was a failure of communication. So I'm going to leave it in your all's hands. The last thing you need is someone who is trying to get rid of our corporate years of harping on people to get stuff done and follow up. So I leave it between you, among you, etc. And I believe, Megan, you talked about a group that gets together. But anyway, I thank the speakers today. Dr. Eccles, we'll have you
Yes.
as the last question.
So I will try to keep this short, but I think one of the things that came out, at least for me, just as a citizen with the experiences in East Palestine, was it seemed that, at least in the beginning, from a public perspective, that there was a lot of confusion and maybe hesitation around reporting as far as, what chemicals the public was exposed to, how those chemicals needed to be, handled and things like that. So my question is more so, and I think this will probably more for Louisville Water, maybe MSD. What kind of processes do we have in place for Louisville as far as either testing or monitoring to know exactly, you know, what chemicals are available? Like, is it all dependent upon whatever entity it is letting us know what potentially is spilled or what potential exposures are out there? If it were not self-reported, do we have mechanisms in place that will let us know, you know, there's an uptick in, you know, whatever parts per million coming into our water? Like, I kind of would like to know that we have some checkpoints or reassurances in place to know if we have a potential chemical exposure or something like that, outside of maybe just the reports that would come from you know, whatever private entities are moving about on the Ohio.
Yeah, thanks for the question, Dr. Eccles. This is Chris Bobay with Louisville Water. We can't take our eyes off the river. We're not afforded that luxury. So, you know, in response to this particular incident with Ohio EPA, local emergency responders, the decisions that were made immediately, you know, on scene directly after the derailment, I can't speak to the mobilization of the field resources and the testing plans and the feedback loops to affected individuals, how quickly that was communicated, I don't know. But here in Louisville, once we had detections of anything in the river, we were in close collaboration with everyone along the river, tracking this thing all the way down as far as we could track it until we couldn't detect it anymore. And so yes, we will respond when we get a spill report. We have a motto here: trust but verify. It's a military code, right? So we take those reports seriously. We investigate all those threats, but we don't ever take our eye off the river. We always have, with our lab and our lab's capacity, we operate every day of the year, looking at the river. And what we do is we scan the river for the family of chemicals of volatile organics. So our methodology allows us to screen for thousands of chemicals that shouldn't be in the water, and so we can respond to any detection of any of those chemicals, and we're calibrated so that we can quantify those and know what those levels mean and how to interpret those levels relative to health standards. So that's part of what we do every day, and that's what we continue to do after this. You know, there's been some talk and concern about legacy issues associated with the derailment site. We don't want to see anything come back into the river from that. They've done a good job with cleanup. It's still ongoing, but we're going to continue to surveil the river to make sure that our water's safe.
Thank you. So I think the response, Dr. Eccles, is 24/7, which is a good thing, similar to what the Environment Institute does on other similar issues with wastewater. And I think that's an appropriate mechanism. Like I said, not concern, but the opportunity lies in communicating to the public, which is always people struggle with. But we need to do that. Other questions from the board? Speakers, I am incredibly grateful for your time. This was both timely, instructive, and insightful, and I'm sure there will be follow-up. And please stay safe and be well. Okay. Let's move on. Before the chair recognizes Deputy Mayor George for her report, just a note that the Kentucky State Legislature passed a bill signed into law by the governor, which I believe amends the qualifications for a public health director by removing the requirement that the individual must be a physician. And I hope I got that right, Madam Deputy Mayor. And the chair yields. Oh, one other point, sorry. In federal action, I think most of you are aware that given the end of expanded pandemic era Medicaid coverage, the Kentucky Medicaid program is currently redetermining about 45,000 Medicaid recipients for those who were added to the rolls over the past couple years. So we will turn to Ashley Shoemaker later in this meeting as she reports from the Medicaid Enrollment Coverage Coalition. So Deputy Mayor George, the chair yields to you.
Thank you. I will just say briefly that it was such a great honor this week to observe our Family Assistance Center that was set up in response to the crisis. And I want to say I see Paul Kern is on the meeting today. Getting to see public health work collaboratively with all entities from LMPD Victim Services, Red Cross, 7 counties, emergency services, was a true honor. And being able to see that set up so quickly, and that was one of the pieces of feedback we heard from partners, that it was set up in such a way that really reflected lots of careful planning and ongoing collaboration and work. And it was to the benefit of the families that were served. So just want to thank and spotlight that work. I think it's the value of, in part, how the Board of Health can serve as that catalyst for bringing people together. And just want to encourage, continue spotlighting of those services that, for most Louisvillians, I think they, are unaware that they exist, but would surely be comforted to know that level of security and service provision exists. Thank you.
Anything else from any of the other areas? Hats off to the emergency management folks, Paul Kern in your area, Connie Mendel, and the entire department for efforts here, because it truly takes a village to affect positive changes. Director Howard's report was included in your pre-read. The chair yields to Dr. Howard for any new issues confronting either the department or public health that we should be aware of. Just a minute or so on that.
Be very brief, Madam Chair, and I won't be duplicative of Deputy
Can you
Mayor
turn your volume up,
George.
please?
I don't think I can turn the volume up on my end. Can you hear
Okay,
me
that's
better?
good. Just be close.
Yeah. It's very nice to see everyone, and I would just be remiss to say, from a healthcare standpoint and as a physician and surgeon, the toll that it takes, the toll that is taken on providers in caring for these gunshot wounds, as expressed by Dr. Smith in his interviews, is real. And for those of you who are in contact with healthcare providers or have family, friends who are, reach out to them during this time, because it certainly does take a toll on our healthcare system that's already stressed by several years of COVID-19 response. And so it's time to embrace our families, our community, but also our healthcare provider community as well. With that said, I do think we are considering internally, and we'll be discussing more internally today, about what the public health role is in gun violence. And we've seen in recent years, folks have talked more and more about what is the role of public health. And certainly it is clear that our role is to advocate for evidence-based research, which there has been some resistance to over the years. And I think that's what we'll be discussing internally at our department, and perhaps this board will have a role in that, and or policies that come forward in the coming months or years. Just one other point that I want to make that was in your report that I want to draw attention to is the ending of both state and federal public health emergency responses to COVID-19. Most of our COVID response has moved out of a direct need for those fundings. We remain in the green status, and most of our epidemiologists, including myself, believe we are at a steady state of COVID-19, which we'll see minor peaks and drops from. But I do want to draw attention to the fact that there will be significant changes in the way state Medicaid functions and is funded from the federal government, which may result in some folks not having able to access insurance as quickly or as easily. And so we don't have a whole lot of role in that space as a public health department, but certainly our state colleagues will, and we will be doing all we can to encourage them to support those who may be affected in our community. With that, I'll pause.
Questions for Dr. Howard? The next on my list, as we move to Community Advisory Board updates, and I didn't see Eva or Angela from JCPS, but I would tell you that I'm on the Health Advisory Council for the system. And we had a rather, at least for me, good meeting with some statistics that were quite scary, but there are people on this call who probably know this better than I. Dr. Stone talked about the huge number of medical conditions that kids in JCPS come to school with, and are mostly located in the choice zone. She announced that there would be a dedicated physician in choice schools, those with the lowest in academic standing and resources. So high throughout the system, chronic absences, which are causing at-risk academic standing. 30% was what she talked about. They have nurses in every school, which are beginning to address this, and their primary focus right now is both identifying conditions, because they do have an EMR system now, or EHR system, that can track all of this. And but they're going to have a dedicated physician, as I mentioned, in choice schools. And I mean, it's very, very interesting in terms of 36% of students in the system are testing at grade level. So 2/3 of children are not testing at grade level. In terms of reading, and math, of course, is much lower. 50% of Caucasian white students are at reading grade level, only 20% those for persons of color. Clearly issues within the system, and we'll have a report from her at a later time. They are hoping that the change in school time helps, but it's an experiment. And the nurses who are located at schools are working on the attendance issue and looking to health concerns. There are 29,000 health conditions reported for young people. There are some that could be double counted in that, with the top one being asthma, followed by diabetes, ADHD, and seizure. Those are the top four. And they're trying to do screenings as well for young people. So anyway, so much for that. And Dr. Hargett, I saw you on, there you are. I don't know if you were on earlier when we discussed the tragic events of the previous days. But what I was wondering is, has the Greater Louisville Medical Society taken a stand on gun safety? That's number one. Actually, that's number two. Number one is that a takeaway that the chair has had from this, from the emotional, compassionate, and instructive comments made by Dr. Jason Smith as it relates to the trauma, because he's a trauma surgeon, situation that he's encountered over the last 15 years. I was wondering, and the desire to change laws and codes and regs, whether or not there are physicians who would be willing to advocate, because elected officials in government are not trusted in the same way that healthcare professionals are. And so if you could speak a little of that, that would be helpful for just a couple minutes. Dr. Hargett?
Can you hear me?
Now I can.
Okay.
Yes.
Well, thank you, Madam Chair. First off, I just want to say as a physician, as well as the representative to GLMS, first, we want to offer our heartfelt condolences to the families of the loved ones lost, as well as prayers to those who were injured. Gun violence is an epidemic in America, and we have seen more and more mass shootings. This invokes a lifetime toll, if not physical and psychologically, then psychologically for those involved and all involved. We've seen the outstanding response of law enforcement, first responders, and the ongoing work of our health professionals. We've seen the work of the EMT, nurses, staff, and ongoing treatment. We've seen the community support, as well as prayers, vigils, protests, etc. You asked, do we have a position on gun reform in GLMS? And we do. GLMS wholeheartedly supports responsible gun control measures at both the local, state, as well as the national levels. We advocate for that. We have been to the Capitol to advocate for that with our legislators. We do that locally. We've had local meetings, group meetings in place for that. And we as a group will continue to have meaningful discussion with parties involved, different stakeholders involved in that. And we will continue to support issues surrounding gun violence to include mental health and promote and support measures for change. So yes, we do, Madam Chair.
That's perfect. And Madam Deputy Mayor, I'm going to follow up with you afterwards on ensuring that, and it's probably true that Dr. Hargett is a part of any roundtable group and others who have Meghan Brown, that physicians are included, because I am well convinced, Dr. Hargett, that your voice is a trusted voice, your being the physicians who take care of us, as well as the nurses. And I've had conversations with Delano Manson, who had another meeting she had to go to at 9, so I know she's not here, but you, the board will receive her report in follow-up email. So Arlena, I'll get that to you. Just remind me, please. Anyway, any other questions for Dr. Hargett? And then Dr. Irwin or Ashley, very, very briefly, a minute or so on family health centers / Medicaid enrollment coverage, redetermination, et cetera.
Heidi, if I may, before Ashley reports on Medicaid unenrollment, I wanted to make an announcement about some vaccine events that are taking place in Louisville.
Thank you.
Family Health Centers has acquired $430,000 from HRSA and has partnered with the Kentucky Nurses Association, with La Casita Center, and with Americana Community Center to provide vaccinations to hard-to-reach populations. I'll go ahead and post in the chat box a link to those scheduled events, and those will all be completed by the end of May. So we have a short time frame to do all this.
That's all.
Kudos to the Nursing Association for their well-organized approach to these kinds of things. We couldn't have done it without them.
Thank you. Ms. Shoemaker.
Yes, as Dr. Howard alluded to earlier, the Medicaid unwinding, Medicaid recertifications have begun again, in Jefferson County, 45,000 Medicaid members will need to take action to renew their benefits over the next 12 months. Everyone will receive a notice from the state, either letting them know that they have been passively renewed or letting them know what actions you need to take to complete their renewal. So it is absolutely critical to make sure that Medicaid members update their contact information with the state. They can go online to connect.ky.gov or call one of their local connectors to check their renewal due date and make sure that their information is up to date with the state. Our next meeting is scheduled for June 12th. That will be after the first round of Medicaid renewals are due. So at that point, we should be able to see, what's going on with those renewals, if people are losing coverage and the reasons why their coverage is ending.
Thank you. Thank you. And it shows the importance and the benefit of having this coalition together to ensure that everyone gets coverage in some way, and a good way to determine what public policy is necessary to make that happen. Thank you. Is there anything from immunization to report that needs action? Not what the committee's doing or anything like that, but no. Okay. Is there any new business to come before the group? Any comments from the board in terms of all that has transpired over the last several days, or comments you wish to make among each other or to the folks who are listening in? Advice, counsel, comments? Okay. The next meeting is May 1st, and it will be virtual, and speaker to be determined. Current events seem to provide an opportunity here. So stay tuned. Anything else to come before the board?
Yes, this is Meghan Brown. I'd like to share an upcoming disaster preparedness for healthcare organizations within the community infrastructure course. This is a no-cost 2-day course hosted by TEACS, and it is part of the 4-part disaster management infrastructure certificate. And I will share that information with Miss Arlena.
That is perfect. Thank you.
Mm-hmm.
Thank you. Anything else, group? Well, with continued work on building a compassionate city, which I think we are, and working on system change, if there are no objections, then this meeting stands adjourned. And my wish for everyone here is to please stay and be well, and a big hug to everyone. Take good care, please. Stay safe, be well.